Hey everybody, it's Dr. Barrett, and we're on the second part of this podcast. We have Dr. Bright, Dr. Taylor Bright, actually. He's the director of Genomics and Metabolomics associated with Wild Health CBD. And he's a serial biomedical entrepreneur with a passion to drive new technologies out of the research lab and into the clinic, which is awesome because we always hear about all this crazy stuff that goes on in the lab, but it takes a real smart person to kind of translate that from laboratory to bedside. So, Dr. Bright, thanks for being on the show.
Thank you all for having me. I really appreciate it.
So I'm excited that you have more of the science, but we just got off the phone with Dr. Dawson, who's the founder and CEO, and I want to kind of dive into what you do and in terms of your role with the company and with the products and what you're working on.
Sure. So, yeah, as you noted, I kind of in the serial biomedical entrepreneurial space, very interested in taking things out of the research lab and getting them into the clinic. And so, had that opportunity to do that with CBD,
Yeah.
with Dr. Dawson and the Wild Health Clinic, and now with Wild Health CBD. And so, very interested in taking advantage of that opportunity and bringing a very science forward, medical forward focus to CBD.
Mhm.
An area where you hear a lot about on the internet, and just CBD is everywhere these days. And a lot of it is quote, unsubstantiated or
Yeah.
untested, and so we were very interested in bringing that science, medical based focus to it, and that's kind of where we start. We start with a focus on the clinic
Hmm.
and how we can bring the purest product to the patient.
Okay, I'm gonna go off script here because I'm curious. What is like one of the biggest myths regarding CBD that is just not absolutely true?
So I would say the biggest myth from CBD, just the one that you see out there the most, is that it quote unquote cures cancer. So CBD could certainly be useful in certain situations, certain cancer situations, but there is just no evidence that it does that. And the amount that you see that kind of out on the internet specifically, but also just kind of in the current zeitgeist, just creates this it's too big of it's too big of shoes for CBD to fill, so to speak. And people put too much into it. I mean, we know that CBD works through the endocannabinoid system on very specific parts of human physiology. Specifically, that's sleep management, mood, specifically anxiety, and then
Hmm.
small aches and pains. So
Hmm.
CBD does enough on its own to not kind of have this this mythical status of almost you know curing death, so to speak, that you see everywhere on the internet. So, CBD serves a purpose for working in a health and wellness setting. It even serves a purpose in a clinical setting, as the FDA has approved it for use in certain clinical conditions. And so, I would say that's currently the biggest myth. And they also you see it can regrow hair, which is also not true. But that's less that's less of an issue than people.
It's funny. It's like cures cancer, regrows hair. Yeah, you hear about that, but all kinds of stuff pops right out.
Exactly.
Now, what has the FDA actually approved CBD to treat?
So specifically, CBD has been approved to treat a subset of very rare seizures.
Okay.
So these are also often seen in pediatric populations,
Okay.
and that drug is called Epidiolex from GW Pharma, and
Okay.
it's used to treat at a certain strength and a certain dosing regimen, as you would expect. Standard FDA drugs, but it also serves a purpose at a much lower dose, a subclinical dose for the health and wellness sector, that's the products that we produce at Wild Health.
Got it. What now? We asked about the beginning of this. Beginning, my question was about myth. What's the latest, hottest study that's come out about a potential use for CBD or something that it can actually do that you've seen evidence for recently?
So, I say the current studies. So, the how CBD works in the body is a complex question that is under current scientific inquiry. So, we're still kind of learning. That's mainly because the research into CBD was very much prohibited for years because of its use in cannabis, which was illegal to be grown. The research that was done at Ole Miss University and was only really done in support of the DEA. So, just in the last 4 or 5 years, we've really been able to bring CBD and specifically CBD not in an isolated form, but in a full spectrum form to the research setting, so to speak. And so the areas that we're very excited about are its effects on as an anxiolytic, so helping with anxiety and other mood disorders we find to be very interesting. But really, we see that in what we consider a full spectrum cannabis products. So that's CBD along with the other cannabinoids.
Okay. And so you're seeing stuff with the full spectrum that you don't see with like a pure isolate of the CBD itself.
Correct. So we're seeing that, and also we're seeing that at kind of lower doses. So where you may have to use a higher dose of just pure CBD, when
Yeah.
you have a full spectrum product that not only has the full set of cannabinoids, but also has a number of other um, terpenes, phytonutrients, other things from the cannabis plant that we find to have a salutary health benefit.
Hmm.
That really leads to a very nice, high quality product that can help in some of these areas. And we know that the cannabinoid system is very much involved with maintaining homeostasis in the body across many different systems,
Hmm.
and that's what we kind of hope to use our CBD products for in the wellness setting.
So it's interesting. A lot of people don't realize that we have an endocannabinoid signaling system in the human body, and I was doing some brief investigation into it. There's CB1 and CB2 receptors in the body. Is that correct? And they both work in different things. Or am I
Yep.
okay?
You're 100% correct. So the endocannabinoid system is one of those interesting systems in that we found the exogenous system, so the cannabinoids from the cannabis plant,
Mhm.
about 50 years before we actually found the receptors that they were interacting with in the body at CB1 and CB2.
That's
So
cool.
rare in that sense. CBD was isolated in the 40s and THC a little bit later.
Hmm.
But so the endocannabinoid system is CB1, CB2, as you said, are the receptors, and they're two effector molecules. One is
Yeah.
called anandamide. That's the one most likely you'll see is associated with the runner's high, kind of gives
No
that
way.
euphoria. And then
Okay, because
another
I
molecule called 2AG.
okay 2AG. What's that one?
So that one is less well known. It interacts
Mm.
with CB1 and CB2, and both effector molecules interacting with their respective receptors, CB1 and CB2. CB1 in the central nervous system,
Hmm.
and CB2 more in the immune system and the gut.
Interesting.
Are all involved in maintaining, they're neurotransmitters, but they're all involved in maintaining homeostasis across sleep, appetite, pain, inflammation. Sometimes they go together, obviously,
Yeah.
and then certain mood issues. And so we're still learning much about this system, and then also learning about how obviously THC, a cannabinoid, CBD, another cannabinoid, and there are about 11 others also interact with this system.
So we've barely scratching the surface. It sounds like.
Correct. I mean, not only are we barely scratching the surface here in this kind of brief discussion, but we're just scratching the surface from a research
Yeah,
perspective.
that's what I mean. I did a master's in science, and we were looking at nitric oxide synthase pathway, and everyone was like, "Oh, nitric oxide is not a cell signaling molecule or whatever." And now it turns out it's a big one, and I feel like that's kind of happening with CBD, and it's pretty cool because some of the things directly relate to what I do as a plastic surgeon. I have a lot of patients that undergo surgery. They're anxious before surgery, and then after surgery they have pain. And what do I prescribe them? Well, I prescribe them Norcos, this is opioid based pain medication, which I think is horrible. And I talked to Dr. Dawson about it. And where I love about CBD is that it helps alleviate some of the dependence on the opioid pain medication. And not only is that good for my patients, but I think it's good nationwide. Have you seen any evidence? I haven't been able to find any. Have you seen any evidence about CBD helping with like acute surgical pain and relieving that?
So with acute surgical pain, we're talking in like probably the 24 to 48-hour range.
Yeah.
Some of the, again, CBD and the cannabinoids are very much involved in homeostasis. So that's kind of maintaining balance. Surgery takes you out of balance. It's a very dramatic interaction.
Hmm.
And so, as you noted, going into that situation, reduction in anxiety, helping manage sleep up to the surgical intervention is also very helpful. So you're in
Yeah.
that best state of mind entering into what is a dramatic intervention at some points. And again, immediately post surgery, may be need for some of these. We'll call them, just for lack of a better term, heavy duty kind of painkillers.
Yeah.
But after that immediate acute setting, as the body starts to kind of return to homeostasis, that's where cannabinoid molecules and CBD specifically can really come in to help alleviate that dependence on, let's say, opioids in this case, where you are having not necessarily a need. You still need to have a need for reduction in anxiety, reduction in pain, but you don't need these heavy duty uh, painkillers. And so, working on that small aches and pains, and then helping, even maybe you just reduce the opioids and bring on some of the CBD to help manage that pain. Is another area it works. So we are actually located in Kentucky, where it's a great place to grow CBD, and we also
Yeah.
have a large opioid epidemic here.
Right.
And so we have a lot of empirical evidence. I can't point to a specific research paper, but we have a lot of working with clinics here, helping reduce opioid dependence when it's not directly related to a pain intervention, and it becomes more of a dependence because CBD can take on that role.
Yeah.
And then we're talking about kind of sublingual ingestion of the oil as well,
Hmm.
and you can also have topical benefits. They've started to find, as they look more closely, CB1 and CB2, more CB2 in skin and other assorted peripheral nerves. And so we find great benefit with using the oil that we make on topical. Now, any open wounds you want to be closed,
Right.
using it as a massage oil to help break up scar tissue and also
Uh-huh.
bring some targeted topical pain relief has also been quite of use.
Is there any evidence on that right now? Any kind of studies on the topical use?
So topical use is very interesting.
Yeah.
These studies are still in progress. We're doing
Mm.
a few here at the University of Kentucky because heretofore most of the work has been done on high doses of CBD or isolated cannabinoids in cell culture, animal models, and then
Hmm.
human. To be fair, without the finding of these receptors in skin and peripheral nerves is relatively new, to the point where we still have discussions with neuroscientists that they don't understand how could this possibly work on the skin
Yeah.
or in a topical manner. And I don't necessarily can't point you directly to how it works, but I can point you to dozens of, if not hundreds of patients who had good results. So
Well, a spa that I go to get a massage here, it's Equinox, it's a gym, and they just recently started carrying a CBD topical, the massage oil, and
mhm,
they're like, "Do you want to add this on?" I was like, "All right, let me try it out." And I did that, and I felt great afterwards. And I've had massages without it, and then I had a massage with the CBD, and I just did a Ironman triathlon, and I was kind of beat up, and I think it made a difference. Of course, that's not a scientific study or whatever, but that's why I was curious to see if there's actually some evidence, and if so, I mean, if not, I'm sure there will be soon, hopefully.
Yeah, I mean, like I said, all of this is in active inquiry, and obviously the FDA wants more studies on this.
Yeah.
It helps combat all the we talked about earlier, the myths that exist out there. And so you can use the sublingual oils that we make at Wild Health also as a topical. It can
Oh,
serve as a
okay.
massage oil,
Yeah.
as well as we're about ready to launch probably here in the early part of 2020 a line of topicals as well that includes massage oil, lotions, and then also a balm.
Oh, sign me
And
up.
that will kind of fill out the line as we're seeing more of these benefits from the topical side.
Fantastic. Now, tell me more about Wild Health specifically, and from your perspective. We talked to Dr. Dawson about a lot of the things that makes Wild Health, I think, a superior product. From your perspective, what do you think is great about Wild Health CBD and your products?
So we think, or our focus mainly is on producing the cleanest, purest product that we can.
Hmm.
So we work with what we think is the best extraction method. So we use cryogenic ethanol.
Yeah.
This what we feel produces the product that is most closely related to the actual natural plant.
Mhm.
We've been using cannabis for thousands of years for medical purposes. We didn't always know why, but individuals have been using it for that reason. And we feel that a cryogenic ethanol, which is a very gentle extraction process, reproduces the natural makeup of the different molecules we're interested in
Mhm.
from the plant most closely. Therefore, and then from there, we do work with our farmers from seed to shelf. So we're there when they plant, we're there when they harvest. We help them throughout the season to produce a clean product, no pesticides, glyphosate free. Using clean soil, lacking heavy metals, and then we test throughout the process. So
Wow.
we do end-to-end testing, in-process testing, release testing. Uh, Currently, over and above it's currently unregulated, market by the FDA, but we go above and beyond to make sure that we have a clean, pure product. And
Yeah,
so,
I think
very much.
people need to know that it's there's so many CBD products out there that you do not know what you're getting, and that's what when I first heard about your guys' company and I did some research, I'm like, wow, like these guys are above and beyond in terms of what they're putting out there, and unfortunately, there's no. I mean, there's a few websites out there about good CBD and whatnot, but there's no like standardization. There's no like rating system out there,
Mhm.
and I think it's how do even people find out about CBD? They can't. And so I found out from you guys about through word of mouth and another podcast that I listened to, and I was just like, wow, this stuff is light years better.
Well, I mean, you're correct. There's currently no regulated market, and there's certainly no regulated market for just isolated CBD. I mean, you can buy, across all 50 states, you're legally allowed to possess isolated CBD. You can have someone in their basement mixing up CBD and coconut oil and selling it out their garage.
Okay.
So
We, I've got a
at
funny joke about that. Like I tell my patients, it's like if someone's trying to do your buttock injections in their garage, you probably want to run the other direction. And probably the same is true with CBD. So
Yep, yeah, and
yeah.
so I think what we see, the number one thing that we see when you're looking around on the internet is that if information about third-party testing and how the product's formulated and what's exactly in it is not readily available on the website, that's a big red flag.
Yeah.
Even if you're as generous as you can be in that situation and just say, well, perhaps these individuals do not know, that's a red flag in and of itself, putting aside any sort of issues that would be more negative than just ignorance in that particular aspect. So, you make sure you see all your testing up front. You should see testing before you buy. You shouldn't have to buy anything to see what's in it. And then you just have to kind of find providers and individuals involved with a brand that you trust.
Now, you also do some work with a therapeutic molecule capable of regenerating damaged neurons in spinal cord injury and multiple sclerosis. Um, is that completely separate than CBD, or does CBD have a role for any kind of regenerative capabilities?
So that specific molecule that they're referencing
Yeah.
is completely separate. So
Okay.
that's actually a biotech startup company that I have done in San Diego, so just down the
Okay.
road from you all, looking at actually unleashing the body's natural potential for regeneration. So in
Yeah.
a central nervous system insult such as MS or spinal cord injury, the breakdown of the structural tissue around the neurons really leads to a lot of inhibition of regeneration. And so we
Hmm.
have a molecule that we think works to limit that. Um, CBD itself in high doses has been shown in tissue culture in some animal models to potentially have some regenerative effects.
Hmm.
That's a long way from the clinic. And if anything, again, getting back to CBD and the endocannabinoid system,
Yeah.
its main effect is probably going to be restoring homeostasis in those areas so that the
Yeah.
body's natural regenerative capacity can take over.
So that's my question is we have these receptors in our body. We have our own natural endocannabinoids. And how is CBD actually helping, right? Is it just kind of like we're kind of lower in some of the endocannabinoids in our own system and we're actually providing more of it? Or do we actually really know how CBD actually works in our bodies when we supplement with it? Because obviously we have some endocannabinoids, right? So
Mhm.
how does it actually work?
So, putting on my cynical scientist hat,
Yeah.
the actual we don't quite know yet, but the most recent research indicates that CBD um, acts in a way that prevents the breakdown of our endocannabinoid effector molecules. That's anandamide and 2-AG. So by limiting the breakdown of those molecules, they're
Mhm.
able to persist longer in the body and then continue to interact with CB1 and CB2 and have those positive effects.
Okay.
Again, anandamide is that runner's high type
Yeah.
molecule and can help regulate some of those systems. That's in contrast to, let's say, THC, which we know directly binds CB1 and starts to have some of those psychoactive effects. That's the kind of getting high, so to speak.
Yeah.
Um, and we also know that CBD and THC are directly antagonistic against each other. For
Right.
instance, if you have a 50-50 mix of CBD and THC, you'll have a lower high psychoactive effect than you would if just you have pure THC. So that's something in the legal states is of interest, as well as we're starting to kind of see legalization spread across the country.
Okay, so THC and CBD both work in the same realm. They just work differently. THC actually binds to the receptors, you're saying, and then CBD actually prevents the breakdown of our own natural endocannabinoids. That's what you're
Yep,
thinking.
that is our current understanding. So,
Okay.
subject to change at the next research paper. But
Yeah.
I mean, like I said, I mean, I'm being probably too cynical with my scientist hat on
Yeah.
here, but we're learning more every day, and that's what we're seeing currently in our animal models, and then as some of our cell culture models.
Is there if people are taking CBD and then they stop taking it, is there a problem with withdrawal, or is there dependency that happens when you take CBD for a long period of time and then you stop taking it?
So we have not seen, and I've seen no reports in the literature regarding dependency of CBD. Again,
Yeah.
because it is focusing on maintaining the body's natural balance. It's not trying to push you one way or the other.
Okay.
So, i.e., if you're pushed too far one way, let's use caffeine as an example.
Yeah.
Something that a lot of people have withdrawal-like symptoms from. There you're pushing the body into a different state, and when you go back into your natural balance, the body is like, "Hey, I want to be back where I was," and you start to have those withdrawal symptoms. To put it somewhat lightly. CBD focusing on maintaining that natural balance
Mm.
already doesn't look to exhibit those effects. So we don't see any dependence. We don't see withdrawal. You can have some tolerance, just like any molecule that you take,
Yeah.
which you can either address by taking more of it. You can address by cycling it. Like any molecule, you wish to take it only when you need it. There's no
Hmm.
real need to keep things on board. If you are not of need of it. So that's very much with working with potentially some of your patients pre and post op rather than directly all the time, so to speak. But we have individuals who have a lot of sleep issues, and it works very well for them on a regular routine basis.
Got it. I mean, honestly, it seems like one of those miracle drugs out there. I say that about Botox, because Botox is like it's got properties that have all been beneficial, and we haven't found a negative really for it. But
Mhm.
CBD, it seems like that could be. And it seems to me that it's kind of a one of those products that it's kind of a win-win, and it's a lot less problematic than certain things like caffeine or alcohol or Advil, even or ibuprofen. So
Mhm. Yeah,
um,
definitely. And I mean, and that's why we push to talk about it more in the wellness space, the supplement space, than as opposed to in the drug space. Now, at high dose levels, it does have clinical effect, and those can be honestly quite miraculous in themselves, especially in
mm,
some of these pediatric populations who may have hundreds of seizures a day,
yeah,
and high dose CBD can really help them. But as a natural day to day supplement or a wellness type molecule, it seems to have a lot of benefit and limited to be to be most appropriate about limited negative effects.
exactly. And Dr. Dawson mentioned possible anti-inflammatory properties. Is there actually any evidence to support that?
So one, we know that the endocannabinoid system works a lot with immune system, gut inflammation, specifically the CB2 receptor.
Hmm.
And so again, CBD helps maintain that homeostasis, as well as we've seen that in tissue culture models, as well as in some animal models. On the human side, we see that mainly in some of your autoimmune related gut, IBS, and other sort of issues like that. We see good effect there. Um, with those populations. And so the anti-inflammatory area is something of great interest
Yeah.
to us, and could really move it. Could be another use for it in the clinical setting.
Yeah, fantastic. Yeah, I mean, I take your product every day. Dr.
I
Dawson is,
appreciate that.
yeah, I think and I've tried a bunch of other stuff. When I went to Vancouver, I went to I had to go to a smoke shop or something to try to find some CBD because I wasn't sure if Canada even allowed me to transport it, and there was some crazy stuff out there, and I don't even sure if it worked or not. And so I was glad to come back home so I can take the Wild Health CBD again. Can people in Canada order Wild Health CBD from you guys, or do you know if there's any international shipping you guys can do?
Um, so currently, so they could certainly order it.
Yeah.
Usually, the problem is they get hit with some decent taxes on the
Ah,
Canadian side of the border. So we
okay.
can get it. We can get it to them,
Yeah.
but it's not always as easy once it gets to the border and then goes
Yeah.
from the border to them.
I
So
see.
um, at the moment, still something that we'll have to wait for our international trade to work those situations out.
Got it. All right. So back to CBD and what you're working on specifically. Is there any kind of new focus that you guys are really working on right now, or latest breakthrough that's about to come out, or any hot news that you want to share with us?
So as I mentioned briefly a little bit earlier, bringing out some more of these topical products
Okay.
is of great interest. We, we're having the oil, we're having a lotion, we're having a balm. All of them we see different effects
Yeah.
for arthritis, mainly osteo-based, but also
Hmm.
a little rheumatoid-based. We're seeing great effects on hands and ankles
Wow.
there. Our balm is working really well for basically knees and elbows, some more peripheral joints.
Okay.
So that's an area that we're seeing kind of you get that more targeted effect,
Yeah.
and so we're excited to kind of launch those here in the first little bit, and then we're also looking to do We're trying as best we can to work CBD in with other beneficial molecules. So we have a sleep blend that is currently out,
Yeah.
which
I've looked
involves
at that on your
melatonin.
website, and it's out of stock sometimes.
It shouldn't be. I'll check with
Yeah.
the production guys tomorrow and see
No, but it's a
if we can
hot
get some
item.
more up there.
Yeah. So what is
Yeah,
it
no,
special
it's
about
very
your,
interesting.
what is special about your sleep blend?
So for that, we add lavender and melatonin, and then
Okay.
CBD. So we know
Okay.
CBD is working on sleep, and with two other sleep promoting molecules. We see it. I know the hot word is adaptogen these days, but
Yeah.
we see it useful because it helps individuals who need help falling asleep. It helps them, and it also helps individuals who have problems waking up in the middle of the night. So it seems to
Oh,
help
okay.
there as well.
Wonderful.
We've seen really good results with that with some of our PTSD folks, which is a lot of our military first responder groups that work with us as well.
That's really
Um,
curious. Yeah. PTSD is a huge problem. Is there actually any evidence that's saying that CBD can be used to treat PTSD?
there is no
Uh-huh.
official clinical research on that. A
Okay.
lot of anecdotal research. We
Yeah.
work with a lot of veterans groups. Work with a lot of veteran farmers here in Kentucky as well,
Right.
and so we have a lot of good anecdotal evidence that it works well in that population for many of the things that it works well for, routinely. So that's anti-anxiety, sleep management, and then small aches and pains.
Well, great. Well, Dr. Bright, again, I can't thank you guys enough for being on the show. And again, you guys have graciously extended us a promo code for our listeners. It's Dr. Barrett's DRBARRETT, and you go to the wildhealth.com website, plug that in, and you get a 20% discount on any of their products, as far as I understand. And honestly, it's been the best product that I've come across. It's helped me with my sleep. It's helped me with like some of my aches and pains and stuff like that with surgery and training and exercise. And I think it's just so unknown. I wish more people would know about it. And I appreciate you coming on the show to kind of help spread the word.
Well, I really appreciate you having us on. Really appreciate your support of us and the product. And what we're looking for is more people to help spread the word on what we think is a great molecule. We'd love if you choose our molecule, but really
Yeah.
we're most interested in getting this out there from a pure, clean perspective and helping groups a more natural remedy to some of these situations they have.
Yeah, absolutely. Dr. Bright, thank you. You guys are doing it right, and you deserve to be rewarded for that. I hope the best for you guys, and just speak nothing but high things about your product. So thank you.
Thank you guys. Really appreciate it.
Okay. Thank you. Bye-bye.